Hi everyone, today I will be talking about schizophrenia. So schizophrenia has the approximate lifetime prevalence of 0.3 to 0.7%. As according to the DSM-5, schizophrenia is a disorder whereby an individual must show two or more of the following, each present for a significant portion of time during 1 month period or less if successfully treated. At least one of these symptoms must be delusions, hallucinations, or disorganized speech. Other symptoms may also include grossly disorganized and catatonic behavior and negative symptoms such as diminished emotional expression or avolition. If you would like to know more about each of these symptoms specifically, please watch my other video named as Schizophrenia Spectrum and Other Psychotic Disorders, What Are They? And there is a link in the description box. Now moving on to other diagnostics, for a diagnosis of schizophrenia to be made, the individual must also show, for a significant portion of time since the onset, a decreased level of functioning in one or more areas of life. This could be work, interpersonal relations, or self-care, and so on. In addition to that, it is important that schizoaffective disorder and other depressive or bipolar disorder with psychotic features has been ruled out before a diagnosis of schizophrenia can be made. It is also important that the disturbance is not attributable to the physiological effects of a drug, medication, or another medical condition. Lastly, it is important to note that if there is a history of autism spectrum disorder with a childhood onset, the diagnosis of schizophrenia can only be made if delusions or hallucinations are prominent. Now moving on to other associated features. It is common that individuals with schizophrenia may display inappropriate affect. For example, laughing in the absence of an appropriate stimulus. They may also show dysphoric mood, which may take form of depression, anxiety, or even anger. In addition to disturbed sleep pattern, such as daytime sleeping and nighttime activity. In addition to that, they may also show a lack of interest in eating food and show signs of depersonalization and show cognitive deficits. Now, schizophrenia typically emerges between the late teen and the mid-30s, and the onset prior to adolescence is very rare. Some of the risk and prognostic factors include genetics, as schizophrenia tend to run in the family, in addition to some research showing that schizophrenia can be related to brain development, as people with schizophrenia have shown subtle differences in the structure of the brain, and also very commonly a change in the level of the neurotransmitter serotonin and dopamine levels. Apart from genetics, environment is also important. Looking at the environment alone, season of birth has been linked to schizophrenia. In addition to this, schizophrenia is more common in children who grew up in an urban environment and for some ethnic minority groups. Lastly, pregnancy and birth complications have also been linked to schizophrenia. Research has shown that people who develop schizophrenia are more likely to have experienced complications before and during their birth, such as low birth weight, premature labor, or a lack of oxygen during birth, and the mother suffering from flu. I really do hope that you have found this video useful. If you have, please leave a comment or a like, and don't forget to subscribe. Thank you so much for watching, and I will see you next time.